cancer of the cervix is a major problem in this country.
Kaniambia, Millicent, I'm sorry, you have cervical cancer stage 4. I felt very bad.
So we're losing a lot more women to a preventable disease.
Even if we cannot eradicate, but at least minimize to a great extent this disease.
I was the first one to be vaccinated.
Hiyo vaccine ikitoka mtoto wangu atakuwa wa kwanza. Kwa nini? Sitaki apitie, go through ile yenye nilipitia.
Thirty-year-old Millicent Kagonga crafts a mat with fine, flexible teal and white thread wrapped around her crochet hook. Teal and white are the colors of cancer in January, but Millicent isn't just knitting. She's telling her life story.
Nilipata mtoto wangu wa kwanza na 14 years, kapata mtoto wa pili na 16 years, kapata mtoto wa tatu na 20 years. 2010 nikaanza kuwa na discharge, na hiyo ndio ilifanya ndoa yangu ikavunjika. Na pia tena second born akakufa.
The discharge she was having didn't just cause her discomfort. She noticed that she was starting to bleed. A sanitary pad could not contain it. She had to use her t-shirts. Her husband, who eventually left her, didn't understand what was going on. Neither did she. It was only in 2015 that she saw someone else talk about having cervical cancer on TV. Millicent realized that she had the same symptoms. Working as a house help, she requested to go to the hospital.
By then nilikuwa na 26 years, 2016 hapo. Wakaniambia huwezi kuwa na kansa kwa sababu hiyo ni wewe bado mdogo. So nikajitia moyo juu ya zile symptoms. Wakanipea antibiotics, the stronger one, but hazikuwork. After 7 days nikaenda pia kwa hospitali ingine pia hapo Coach. Nika insist wanifanyie screening. In fact walikuwa nakata. Wananiambia I'm still young to have cervical cancer. Cervical cancer ni watu wa 40 years. So nika insist. Wakati nili insist wakakubali, wakanifanyia test, wakanifanyia screening yenye inaitwa VIV. Wakati aliingiza hiyo speculum kwa cervix, ilirudi hivi na madam mingi mpaka ilimchafua top yake. Akaniambia, Millicent, I'm sorry, you have cervical cancer stage 4. I felt very bad. I wanted to kill myself. Nikakumbuka I was raised by step parents. Kwa hivyo the best I can do ni niende niwe watoto wangu na nikuje nijiue. Ndio nisiache mtoto wangu akiteseka.
Yes?
But Millicent is not alone. The Ministry of Health data estimates that cervical cancer, a serious disease that affects the cervix, kills on average in Kenya 9 women daily. The cervix is the opening of the uterus or the womb of a woman. If the uterus were like a bottle, the cervix would be the bottleneck. In Kenya, there are 5,500 new cases reported every year. In 2018, 5,250 cervical cancer cases were reported in the country. 63% resulted in death.
More than 2,000 dead women is a very high number. These are the only ones known. The ones out there in the villages, where nobody knows, where nobody cares, where nobody looks for them. Nobody has any idea about the true burden of cancer of the cervix in this country.
By the time the symptoms come in, we're in trouble. We're talking about stage 3, stage 4 cancer, occasionally stage 2. And with cervical cancer past stage 2, we're already treading on dangerous waters. So it is asymptomatic for most people for the longest time. But when now we start having the symptoms, a lot of the times most women will start with a persistent abnormal vaginal discharge, which if we're not examining them when we are treating them, they keep being treated for everything else other than checking out what the real problem is. Then they may have what we call postcoital bleeding, tending to noting spotting or even frank bleeding after sex. And then as it gets worse, because it's a mass, it is growing very fast, patches of it will start to die off just because they're not getting adequate blood supply. It's dead tissue. It's going to get infected, it's going to rot, and we're going to start having now very bad smelling vaginal discharge. By the time we're having that, most of the time we're looking at stage 3B, stage 4 disease, and it is pretty much too late.
But in order to understand the real damage, we must first ask what causes it.
Human papillomavirus is a group of over 100 viruses. 4 40 subtypes of this virus infect human beings. 16 of them so far, science has shown, are associated with infections in the genital and lower GI areas.
But infection of cervical cells by the virus alone is not enough to cause the cancer. In fact, the human papillomavirus or HPV infections are common, both in men and women. But the good news is
that the human body is always able to remove 98 to 99% of all these viruses from the body using natural immunity.
Patients with a poor immunity have a higher likelihood of progression into cervical cancer.
The big question is, how do we prevent it?
Cancer of the cervix has been beaten in most parts of the world, in Europe, in America.
And by the time women are about the age of 25, more than 70% of them have already contracted this virus. It is that common. There isn't much you can do to prevent it unless you're completely sexually abstinent.
But in a country and global dispensation where children as young as 10 years old already engage in sex, the picture is changing. There is also an increasing incidence of defilement of minors and early marriage, in addition to the growing cases of multiple sexual relationships.
One is going to be exposed because 50% of the population having is quite high. And the fact that one has it, it does not mean one is promiscuous. We must be very clear on that.
That is why experts believe that focusing on abstinence alone is not enough.
Number one, the ability of the body to remove human papillomaviruses out of the body. And number two, consistent, structured examination of women with screening with pap smear and treating this disease in the earliest stages, long before it becomes cancer.
Screening is not something we can compromise. First world countries have succeeded to eradicate cervical cancer because it's literally almost a crime to not go for your annual pap smear.
The pap smear has been the gold standard for the cervical cancer HPV screening. It examines a sample of cervical cells for signs of cancer, but it is not accessible and affordable to every woman. There isn't enough awareness. Even women who may suspect that they have cancer do not want to know, mainly owing to the stigma around the disease.
Kwa plot watu wana stigmatize the smell. Kienda kwa blood, saa hiyo iko kwa community. Unaona, nasikia ule alilaaniwa, ule hiyo ni kiboko ya Mungu. Kwa nini ana bleed?
If anyone understands the cost of not having the screening done or the cancer diagnosed early, it's Millicent. Treating cancer is an expensive venture. At the early stage, a combination of chemotherapy and radiotherapy has a cure rate of 90%. It can sometimes mean the removal of a woman's uterus and even the termination of a pregnancy of the woman with cervical cancer.
2017 alone nimeongeza 14 pints of blood na nikaanza treatment. Nikafanyiwa radiotherapy 25 cycles, nikafanyiwa chemo ilikuwa nifanye 6 cycles, but kwa sababu ya kulipa blood count ilikuwa so much challenging for me. Nikafanya 3 cycles of chemotherapy. Alafu kuna matibabu inaitwa brachytherapy ya kufanyiwa ndani kabisa, nikafanyiwa 3 cycles.
For a single mother of 2 with no formal employment, the NHIF funds from well-wishers and her own savings help to pay for her treatment, but even after, the side effects are still devastating.
Kitu ya kwanza, I'm 30 years, nilifika menopause nikiwa 28 years wakati nilimaliza treatment. Kwa hivyo unaona mwili yangu already iko overweight, hizo ma hot lashes, nikienda chomi utoa damu.
But now the focus is turning to prevention.
The push that gynecologists and pediatricians are having is, can we incorporate these vaccines in the childhood vaccines?
The current women population in the reproductive age never had a chance of being immunized against the human papillomavirus.
Even earlier than, slightly earlier than 2007, HPV vaccine has been used in Kenya, but mainly in the private sector.
But at a cost of 12,000 to 13,000 shillings, the vaccine has been largely out of reach for many parents in the country, and the awareness about the vaccine and its importance remains scarce. By August 2009, vaccination was recommended before adolescence and the beginning of potential sexual activity. Rwanda was among the first countries to launch the vaccine. In 2011, Rwanda's Ministry of Health partnered with Merck to offer the Gardasil HPV vaccine to all girls of appropriate age.
And we are seeing it in Rwanda, the burden of cancer is really going down. And they're talking of eliminating the HPV, the virus.
On 26 November 2015, Uganda launched the HPV vaccine. On April 10, 2018, Tanzania became the 7th African country, following Uganda, Rwanda, Botswana, Mauritius, Seychelles and South Africa, to introduce the HPV vaccination into its routine immunization program. The World Health Organization, WHO, recommends HPV vaccines as part of routine vaccinations in all countries, along with other prevention measures. The vaccines require 2 or 3 doses depending on a person's age and immune status. Vaccinating girls around the ages of 9 to 13 is typically recommended.
Just 1 dose is not enough. The first dose primes your body to respond better. The second dose given after 6 months now elicits even more larger response by the body to protect itself.
The vaccines provide protection for at least 5 to 10 years. Cervical cancer screening is still required following vaccination. WHO says vaccinating a large portion of the population may also benefit the unvaccinated, but the vaccine is not effective if one is already affected by HPV.
The vaccine can be given to someone older, and it is very effective even to girls up to 26 years of age. If you give older people, the effectiveness of the vaccine also diminishes, because the older you get and you more likely you are exposed to the virus. The vaccine, which is actually mimics the virus. So the body is provoked, it's like recognize there is danger. So it produces those substances which now dwell in your system, so that if you get now the infection, they go and bind on the virus and destroy it.
Well done.
On October 18, 2019, the Kenyan government officially introduced the HPV vaccine into the National Routine Immunization Program.
Chanjo hii wenzangu itakuwa bure kwa hospitali zote, ikiwepo ni public, ni za binafsi na pia faith-based.
The launch of the HPV initiative coincides with our ongoing efforts to improve and strengthen the prevention and management of cancer in our country.
There are 2 types in Kenya, there's Gardasil and cervix. The government is rolling out the Gardasil. It is targeting those subtypes of the virus that causes over 70% of the cervical cancer.
Nimekubali chanjo manake yasaidia mtoto wa kike. Na sasa hii tumeona kama kansa ndio kitu inasumbua watu, imekuwa donda sugu nchini Kenya.
Kwa watoto kuanzia miaka 10 ambao siku ya leo wameweza kupata hii chanjo, na tumedhibitishiwa kwamba chanjo hii ni muhimu kwa watoto. Sisi kama wazazi tumejitoa na tumekubali kwamba itaweza kuwafaa.
But this major milestone was 6 years in the making.
We may be coming a little bit late into the space because of our dynamics and because of the logistics around availability of this vaccine, but for sure we will be able to be one of those success stories to be talked about in the region but globally.
Kitui County, nestled in Kenya's lower eastern belt, or what was formerly known as the Eastern Province, is a county of untapped abundance. It is a semi-arid land with a population of nearly 1.13 million people.
The journey to introduce the HPV vaccine into the national routine immunization program began here in Kitui County. It was the successes of this pilot that informed how the vaccine would be rolled out into the routine immunization.
We needed to sort of pilot to ensure that there is no adverse effect out of this. We needed to carry the communities in terms of assessing their level of resistance or lack of it. So it was used actually as a launching pad to be able to mobilize community. We also needed to generate our own data to be able to use for advocacy. Those 3 things did happen. So when it came to now having a conversation for scale-up, we already had our own story, which was a positive story.
The HPV vaccine pilot vaccination was carried between 2013 and 2015 in Kitui, covering 22,500 children of ages 9 to 11. In Kitui Central Sub-County, Justus Mutie, a father of two, a son and a daughter, recalls the time of the pilot.
About the HPV vaccine, I heard about it in the year 2013. All the girls in class 4 were to be vaccinated.
His daughter, Florence Mweni, then was aged 9, a class 4 pupil at the Kitui Central Primary School.
I was still in class 4, and that year, before they came to vaccine us, some people came to advise us about the vaccine. They came and told us all about it, and then after some time, it was actually launched in our school. It was like a big event. They were stressed out because there's this girl in our class who had told us that that vaccine was going to, like, when we get it, when we grow old and we want to get children, we want to be able. So I was a little bit stressed out. I did not want to get the vaccine. The next day we were all going to come back. I also went and I received it. It was not that painful.
For this family, and particularly for Justice, cervical cancer is a personal story.
And before then, I've seen one of my grannies die of cancer of the cervix. I felt it was important for her to be vaccinated because it was a chance. Before then, she was being treated for an STI, sexual transmitted infection, for some time, until when she was brought to Kitui County Referral Hospital by then. And an ultrasound was done, and it was said that she was having the advanced stage of cancer. And then we were told that because she was aged, very aged, then there was nothing more for her to be done. She died at home.
Niliposikia serikali imetangaza kama kuna hiyo chanjo, nilikubali. Juu nilijua itaweza kusaidia kukinga hiyo ugonjwa ya kansa.
The boys in our class were also complaining that they should also be given the vaccine of prostate cancer, but they actually didn't get it because I don't know even why.
First vaccination, which was a pilot in Kitui County, girls were being given 3 doses. First dose, then after 2 months they are given the second dose, and then 6 months from the initial dose, that is 4 months from the second dose, they were given a third dose.
The vaccine was administered to girls in schools by healthcare providers from the nearest health facility. The pilot, the government says, was highly successful. The coverage of 95% attained with high acceptance and no serious adverse reactions reported.
I did not feel any side effects about the vaccine. I think that the government cannot do a thing like that, and I still think that I'm still going to get children when I grow up.
Of course, like any substance introduced to the body, there may be some reactions here and there, and most of the time they're mild, the swellings, the pain, some fever, and when you are targeting also girls at that age, there are potentials for hysteria because of injection. So let's just be conscious, and the government has put in place elaborate measures to help address this.
This would inform the government's rollout with its partners Gavi Alliance, UNICEF and WHO. The government will then plan to offer the vaccines nationally in 2019 alongside other routine infant vaccines through an existing network of over 9,000 public, private, faith-based and NGO facilities free of charge to 800,000 girls who are currently 10 years old and subsequently to all girls as they turn 10 in future. The country in 2019 had 1.3 million doses of the HPV vaccine against a target of 800,000 for maximum protection. All girls aged 10 must receive 2 doses of the vaccine 6 months apart.
We urge parents not to forget to take these girls for the second dose. It is very, very critical because that's what will determine whether the child will be protected or not.
We are enjoying leveraging on the existing investment in terms of human resource, the cold chain like I indicated. The actual cost of the vaccine is borne by Gavi, our partners in this space.
But against this backdrop, even before the official launch and rollout, there was a growing hesitancy and concerns raised about the vaccine. The Kenya Catholic Doctors Association, on the 19th of August 2019, wrote its official position on the HPV vaccine. We engaged Dr. Stephen Kimotho Karanja, the chairperson.
No country, in fact every country, controlled this disease long before any vaccine was ever discovered. The vaccine you are implying was actually first discovered just the other day, 2006. By that time, the world had already conquered cancer of the cervix, barring, of course, the third world, including Kenya here. So, it was not controlled by any vaccine. Gardasil 4 is made to prevent 4 of the subtypes of the 16. Why is it hopeless? Because even their own advice to women is this: even though you have been vaccinated, you must still continue the yearly or 3-yearly screening like for any other woman who was never vaccinated. But if 98% of the viruses are removed by the body, why do you need to buy a vaccine from a poor resource third world country for what the human body is able to do naturally?
The association claims that based on scientific evidence, the vaccine is associated with very severe and dangerous side effects. These, they say, are based on their findings and include severe brain damage, severe encephalitis, convulsions, transverse effects on the spinal cord, the Guillain-Barre syndrome, paralysis, hemolytic anemia, bronchospasm with asthma-like symptoms. They also list autoimmune diseases, premature ovarian failure, among other conditions.
This vaccine actually destroys its adjuvant, which is aluminium, and the aluminium is used in most other vaccines, but in this vaccine it is very high.
The government, however, rejects these claims completely.
Aluminium is so tiny in the content as part of to make the vaccine more effective, so that we don't give more dose of the virus, but help augment that weakened part of the virus so that it is more effective. And it is very, very minimal. Studies have shown it doesn't cause any adverse effect. It is safe. And I think let's take it 115 countries, including those very highly developed countries. There's a lot of consciousness are using this vaccine. Just that demonstrates the trust.
I hosted them here when they started expressing concern. And what they want Kenyans to believe is like the story of mess. It is not true. I have emphasized it is not true because a responsible government behaves in a responsible way. We are that government. And I did say personally, I undertook and said, since you're raising concerns, I am going back to WHO headquarters one more time so that I am more satisfied. I won't sit here as a minister responsible for health and allow for something wrong happening under my knowledge. And I took them for a long time. We had meetings, and I went back to WHO. The information which came back to me was exactly the information which my team had used since 2015.
The association also claims that the fast tracking of the vaccine by the drugs regulator in the United States, FDA, was unusual. The Catholic doctors say most studies of the HPV vaccine were on teenagers and adult women, not young children.
Nobody wants to know that babies, children, are not small adults. If you do a study from beyond age 16 to age 26, that's where your studies have been done. Now they want to inject children in this country at age 10.
This vaccine is in another 114 countries. Who are we? Who are we? And who is this in the other countries who would be introducing a vaccine that, is ill-meant, that is not efficacious, that is negative?
But the vaccine has to be given before sexual activity starts, so doing it before age 10 in childhood in Kenya has been deemed vital for it to prevent cervical cancer.
Let us not fight science. Let us work together. Let us answer questions from an intellectual point of view. Let us talk and discuss, and let us agree, because I believe we all mean the same. We all want the same. We all want a bright and prosperous future, not just for ourselves, but more importantly for our children.
Another concern is the likelihood of injuries, especially where the vaccine is administered as an injection.
Nurses and other health workers who have been trained in the clinical area and are trained to administer even injections. Yeah, community health volunteers do not administer the vaccine.
In late 2014 to early 2015, there was a strong campaign by the Catholic Church against the tetanus vaccine, targeting girls and women of reproductive age in 18 high-risk countries, including Kenya. WHO maintained that the vaccine was safe and effective. Cardinal John Joe was quoted as arguing, and I quote, "The fact that this campaign only targets women shows that there is something fishy about it. Otherwise, even men and children should be vaccinated." End of quote.
Tulikuwa tunaomba hilo kwamba serikali isipokee tu chanjo kutoka nje, uanze kutumia na watu waanze kuadhirika na wanakimbilia mahospitali yetu. Mataka mengi tuna experience tangu mwanzo, kwa sababu pasipokuwa na ushirikiano, kuna watu wanapenyeza nchini mwetu madawa ambao ni kinyume cha matumizi ya afya, ambao nyinginezo zimepigwa marufuku nchi mbalimbali, na huku tunakuja kutumiwa kama guinea pigs.
When I asked if the KCDA's position is also the position of the Catholic Church,
I'm shocked and disappointed by that your question. You are here. I told you I'm a practicing obstetrician and gynecologist, one of the most senior doctors in this country. I am dead on preach. Why did you go to church to get that information? When you bring religious information, religious things into this office, it's really unacceptable. I want science. Talk science. If you want to talk religion, if you want to talk Catholicism, go to the bishops.
Ni wazi tumeridhika na jambo hili, tunasema liendelee kulingana na mipangilio ambao ni ushirikiano kati ya serikali kuu, serikali za county, faith-based hospitals and dispensaries and health centers, na pia wale ambao walikuwa na tatanishi ama hofu kwamba tumeikubaliana iweze kusaidia. Ni wazi ugonjwa huu wa saratani umekuwa ni changamoto kubwa katika nchi yetu, na sio tu sisi wenyewe. Kwa hivyo nina hakika kwamba kama ningekuwa najua kuna dosari, singesimama na kutoa ile sala. Kama ningejua kuna dosari kwa sababu ya dhibitisho fulani, ningesema tungoje kwanza mpaka tuafikiane.
Vaccine hesitancy and lack of acceptance, however, is not just a reality in the developing world. The HPV vaccine was introduced in Japan in 2009 and added to the national vaccine program in April 2013. In the same year, some vaccine recipients complained about severe side effects. In June 2013, the Japan Health Ministry suspended its recommendation that all girls in their early teens receive the vaccine. This caused the vaccination rate to drop from 70% from girls born in the mid-1990s to 1% presently. The Japanese Health Ministry has also funded research and set up advisory panels to study the alleged side effects.
The reality is that when the public is made to lose confidence in an intervention that is important, recovery becomes difficult. The government decided, well, you go for the vaccine if you wish to. And now currently you find that the Japanese Medical Association is pushing the government really to come out clear and make this vaccine available for girls, because there's a lot of missed opportunities.
Umesikia wase wakisema ati sasa zile umedunga mtoto hiyo vaccine unamu-encourage aende afanye sex. Hapana. Nini vaccine ni kama tu hizo polio, ni kama hizo vaccines zingine.
There was a lot of propaganda from some section of people. There was a story which was running in the social media that a girl was vaccinated elsewhere and maybe she was moving in rivers. So that fear was there as a parent. It was there. And also there was a propaganda that once a girl is vaccinated, she may not be able to bear a child. But for us as parents, we felt that there is no government which has ever done wrong against its people.
HPV vaccines in India, which has one of the world's highest HPV-related cancer burdens, have been at the center of controversy since 2009, when a clinical trial conducted by the American non-profit Path was claimed to have caused the death of 8 girls given the vaccines without their parents' consent. But an inquiry showed that not to be true. The deaths were not related to the vaccine. One girl drowned, for example.
In India, some of those deaths that were being reported against these vaccines, they were actually children dying out of snake bites and all that kind of stuff. But because there was a massive drive, and then it was very easy for the public to link those deaths and, you know, create fertile grounds for rumors, negative ones, which affected the program.
Another concern is largely that the vaccine sexualizes girls early, makes girls to feel that it is safe to have sex, although there is no good evidence that vaccinated girls actually do change their sexual behavior.
Even when I was still in primary school, we used to have these talks almost in every week about sex, and even in high school sometimes we are talked about it. We are told that sex is not good for people under 18.
The vaccine does not make them desire sex. Over 115 countries are providing this vaccine, and there's been no cases of increase in promiscuity over time.
It is not a measure that once you give this, someone will start having sex in early stage of life. We should let them know that, okay, you've gotten this protection against cancer of the cervix, but still the HIV is there, the pregnancy is there.
The Kavanaugh sect, whose largest followings is in pockets of Mwingi in Kitui, has never embraced vaccines and modern medicine entirely. During routine immunization, the government has had to employ the use of force to ensure that children born into the sect are not left behind. We ask whether or not they will take their girls to be vaccinated.
Hiyo ni mambo yao na Mungu, kwa sababu kati yetu kwa Mungu tumepeana, na hatuendi na hatufanyi. Sasa ukiwa unanilazimisha wewe mwenyewe, yako na Mungu.
Hii ni kinyume cha kanisa. Na kuenda ikiwa ni mtoto akiwa anapita shule, hizi kanisa yetu hairuhusu.
Everyone has a right to know what is being given to his child and what it will prevent, rather than coercing and giving it to people by force. That one doesn't work.
So how does the government address such strong hesitancy?
The best approach is to rally them to know what is happening. Traditionally, there's been engagement with the larger groups, you know, the larger churches. But even now, the small churches have been mapped out and they're being engaged proactively.
Hii mandawa ni mtu anaweka kazi yake ndio afanye kazi. Ni kazi hiyo, ni kazi tu. Na Mungu ndio kabisa. Kwa sababu kwa mandawa na kwa nini Mungu ndio hiko.
I would request that they be handled as an individual, not as a group of people. They will listen to their fears. They will accept their girls to be vaccinated. And then maybe sometime they may request that kindly don't show my picture when the girl is being vaccinated. Just do that and don't show the pictures. Or neither maybe kindly don't mark the house to where they live, because they could be attacked by the other followers.
On the day of the official HPV vaccine launch in Mombasa, October 18, 2019, Grace Mercy Millicent's daughter is more expectant than anyone else. She will be the first girl to receive the free HPV vaccine that will now be part of the routine immunization program.
I was the first one to be vaccinated. And if I remember, at first, I said that injection will hurt me. And then it reached somewhere. Something came into my mind and said, don't be angry or don't be so very shy. The injection won't be so very hurting. So I stopped being shy, and even I greeted the president. I was so very happy. I said that will be the happiest memory that I won't forget.
The vaccine may be an important intervention, but it is not the only one. Screening remains a priority for early diagnosis and treatment.
As long as wewe ni mwanamke na uko sexual active, please make sure umeenda umefanyiwa screening na make sure mtoto wako amekuwa protected akiwa bado mdogo.
Access to cancer screening services, has been improved through the provision of basic and advanced screening services across all primary health facilities in our country. It is important to note that making significant health gains from the measures we are taking will also require that each and every Kenyan takes responsibility for their health.
Millicent has not yet been declared cancer-free, but she would never want her own daughter to experience what she went through.
Kama mamangu maybe angepiga hatua kidogo, although by then silikuwa inalipiwa, watoto hawajaanza kudungwa. Mtoto wangu amekuwa kwanza kudungwa kupata hiyo free vaccine, lakini kuna watu wamepeleka watoto wao wamedungwa hizo vaccine kwa hizi hospitali zingine kubwa kubwa. So mimi nilikuwa najambia mamangu angepiga at least a step nipate hiyo vaccine, unaona. That's why na protect my daughter. Kwa nini? Kwa sababu sitaki mtoto wangu afike mahali akae chini aseme mamangu alikuwa na opportunity ya kuni protect licha ya kupitia hiyo magumu yote na pia akalau nipitie hiyo shida.
Cervical cancer can make you be so very bad. Even when the others see you, they can see you like a trash. I encourage those moms that see that vaccination, it's like it's going to get rid of the daughter. So please keep your child safe by giving him the vaccination. It's 10 years old, girls. It's free. Even at the hospital. Please get your children vaccinated.
Is the vaccine the best line of defense against HPV? Should 10-year-old girls be given the vaccine? The answers to these questions may be conflicting, but what both sides agree is that when it comes to preventing cervical cancer, it's not about putting out fires. It's about keeping the fires from being lit in the first place. Dorcas Wangira, Citizen TV, Nairobi.